Module 6, Ethics and Edge Cases, Clearance Level 3+. This is not a philosophy lecture. It is an operational survival document. Because the fastest way to lose people at Site-17 is to treat cooperation like a wish-granting machine. Slide 1. You will be asked to do things that sound compassionate and are operationally radioactive. You will be asked in tears, you will be asked in anger, you will be asked with rank, and you will be tempted to improvise because you want the suffering to stop. Remember the timescale mismatch. If something haunts you for 12 years, that's a chapter of your life. For them, 12 years can be 360. So when you hear just this once, understand. The consequences may keep walking long after you rotate out.
Slide 2. People say help when they mean erase. Erase the diagnosis. Erase the behavior. Erase the memory. Erase the consequence. Real help is bounded. Real help is consent-based. If you can't state the boundary in one sentence, you don't have a boundary. And if you don't have a boundary, the request will write one for you. Next slide.
Slide 3. Cooperation by consent is the spine of the deal. Not consent with a guard at the door. Not consent with implied punishment. Real consent. If fear is the reason someone agrees, you don't have consent. You have leverage. And leverage produces compliance today and backlash later.
Slide 4. People want the universe to grade intention. It does not. Scale is what wakes predators. Sustained work is what draws eyes. So when someone begs for a miracle, remember, the bill is not always paid by the person making the request. Next slide.
Slide 5. When the room gets emotional, your brain wants to improvise. Don't. Use gates, safety, consent, cost. If you can't answer all three, you are not being compassionate. You are being reckless.
Slide 6. This case gets mislabeled first. A child manifests something dangerous. An adult starts speaking about the child like a leaking container. The magic wasn't random. It had a rhythm. Fear, then shame, then isolation. Then the room gets rewritten like a flinch. The first intervention wasn't a spell, it was environment. Lower voices, fewer uniforms, no crowding the doorway, no threat language. You'd be amazed how much power collapses when you stop feeding it. Treat a child like a bomb, and the child learns to live like one. Next slide.
Slide 7. We stabilize the environment before we touch the magic. We gave the child control because lack of control was the trigger. And we refused suppression without assent. Because that teaches a child one lesson. Adults will rewrite you when you become inconvenient. Small interventions, short duration, clear documentation, survivable becomes stable, stable becomes safe.
Slide 8. This request came as a whisper. A researcher, brilliant, exhausted. Her son was 9, Down syndrome and a heart condition that meant hospitals, monitoring, and a calendar written in cardiology. She didn't ask for support first. She asked for erasure. Remove the extra chromosome. Make his heart normal. And I want you to hear this clearly. She wasn't cruel. She was terrified. She wanted him safe in a world that punishes difference. She wanted him to survive long enough to grow into himself. And she wanted to stop watching him suffer. That is exactly why these cases are dangerous. Because grief can be a lever. Next slide. Slide 9. Down syndrome is not a disease you delete. When someone says cure it, they often mean make my child easier for the world to accept. I told her the truth clearly and gently. I will not rewrite your child's chromosomes. I will not gamble with his whole body to satisfy the word normal. And I will not let fear turn him into a project. Then I did the part that matters operationally. I did not abandon her. A boundary without care becomes a fight. A boundary with care becomes a plan. We treat suffering. We do not delete people. Next slide.
Slide 10. We said no to identity rewriting and yes to real help. We supported the medical pathway. We used tight, short protective measures that didn't linger and didn't scale. We reduced environmental stress and harassment risk because stress is a multiplier. And we documented everything, not to punish a parent, to prevent precedent, to prevent leverage, to keep the story from being rewritten later as they promised. This is what ethical help looks like. It's less dramatic than a miracle and far more survivable.
Slide 11. Mercy requests arrive like weather. Pressure drops in the room. Everyone wants relief. There is a difference between easing suffering and ending a life because the room cannot tolerate grief. We can help with pain. We can help with fear. We can help with comfort. But we do not turn death into a shortcut, and we do not ask magic to carry what humans refuse to hold responsibly. Next slide.
Slide 12. Weaponization rarely sounds like a villain's speech. It sounds like urgency. It sounds like duty. It sounds like you're the only option. But the real target is precedent. Once you do it, the next request becomes, you did it before. Then it becomes policy. If someone wants wide, sustained, systemic effect, treat it like a live explosive. Fail a gate. Document why. Leave the room before pressure becomes coercion.
Slide 13. Some of you cope by pretending we are numb. It makes the math easier. It is also false. We remember faces. We remember sounds. And because our time is long, grief does not fade the way institutions expect. If you want to be professional, don't hide behind the lie that we don't care. Own the loss. Stabilize the living. Document without excuses. Reduce the chance of repeating it. Next slide.
Slide 14. Refusal is a skill. If you refuse with contempt, you create an enemy. If you refuse with ambiguity, you create a negotiator who won't stop. Acknowledge the need. State the boundary. Offer alternatives. Document pressure. Exit. You are not denying a person. You are denying a method that harms someone else. Next slide.
Slide 15. Paperwork is armor in this building. Write what was asked. Who asked? What consent existed? Which gate failed? Do not editorialize. Record reality. Reality, properly recorded, is hard to bully.
Slide 16. Your phrasing matters. If you speak like they're a weapon, the room will treat them like one. If you promise outcomes, you create entitlement and pressure. Keep it bounded. Keep it honest. Speak like a professional, not a broker. Next slide.
Slide 17. Ethics is not softness. It's containment strategy. Safety, consent, cost. Refuse early. Refuse clearly. Document everything. Prevent tragedy today and catastrophe later.
Slide 18. Do not trade autonomy for comfort. Do not trade a small tragedy for a wide one, and do not call something mercy just because it is faster than grief. Stand down, report, recover, return to baseline, end module.